All right, I'd like to call the first 2024 meeting of the Joint Subcommittee to Study the Pandemic Response and Preparedness Committee meeting to order. The clerk will call the roll, please.
Delegate Webert, Delegate Gardner, here. Delegate Munden King, Delegate Shin, Delegate Sickles, Delegate Sullivan, Senator Suderline.
Yes.
Senator Favola.
She's present online, I think.
Senator Hashmi.
Here.
Chris Jones.
Present.
Jennifer Siciliano.
Here.
Caitlin Deal.
Here.
Martha Mugler.
Here.
Heather Jones.
Here.
Jacqueline Grice. Lisa Lucas Burke. Here. Tara Dickerson Anderson. Secretary Merrick. Secretary Gadara. Secretary Cummings. Secretary Littell.
Here.
Secretary Cole.
Present.
Secretary Hade.
Here.
Senator Surville.
Here.
You have a quorum, Mr. Chair.
Thank you, Jillian. Appreciate that. Well, we have more items on our agenda today. Before we hop into that, I just want to make sure everybody looks like there's a lot of people here for public comment. I want to make sure everybody understands you need to sign up for public comment. There should be a sheet at the front for you to sign up. We will do that at the end of the agenda, and everybody who wants to speak will have 2 minutes apiece. We have to have a tight timeline on that. First of all, we have a lot of new members here. Because of the turnover in the House, we had a bunch of new appointees. We also have one new senator who's on, so I'd like everybody to introduce themselves. Everybody knows each other who's here. So why don't we start down on my right, Mr. Humphreys. Why don't you take the first?
Thank you, Mr. Chair. Josh Humphreys. I'm one of the Deputy Secretary of Public Safety and Homeland Security here as the designee Secretary of Public Safety here at Cole.
James Williams, Chief Deputy Secretary of Health and Human Resources and also Acting Commissioner of Social Services, standing in for Secretary of Health.
Jason Powell, Deputy Secretary of Finance, sitting in for Secretary Cummings.
Sorry, this is all
There you go.
very high tech up here. Martha Mugler with the City of Hampton City Council.
Jennifer Siciliano, I'm the Chief External Affairs Officer at UVA Health.
Deborah Gardner, I'm the delegate with the 76th District.
I'm Scott Surville. I'm the Senator for the 34th Senate District. I'm also the Senate Majority Leader.
I'm Dave Suderline. I represent the Roanoke and River Valleys in the Virginia Senate.
Good morning. Ghazala Hashmi, representing the 15th Senatorial District and also Chair of Senate Education and Health.
Chris Jones, retired pharmacist.
Caitlin Deal, representing Hampton City Schools K-12 Public Education.
Carl Haight, Executive Secretary, Supreme Court of Virginia.
Lisa Lucas Burke, Vice Mayor, City of Portsmouth.
Dr. Heather Jones, practicing oncologist in Hampton Roads.
Great. Well, welcome to all the new members. I didn't get a chance to go up and down the dais and shake everybody's hand, but we have a lot of new members, and so we're going to do a little bit of reorganization today. So the first item on the agenda is the what do I call this, amigo? The re-election of the co-chairs. Okay, we need to re-elect co-chairs of the committee. Formerly, the co-chairs were myself and Delegate Ware. Delegate Ware was not reappointed to the commission or the committee, so we need to elect hopefully myself and a new co-chair. I know Delegate Munden King has expressed an interest in serving as the co-chair of the commission. She'll be here in about 6 minutes, I think. And does anybody have a motion?
I move that we elect Delegate Munden King as co-chair of this committee.
Okay, is there a second for that?
You need to do both elections.
Yeah, how about both? Me too, yeah.
And Senator Sorrell as co-chair as well.
Good, thanks.
Second that motion.
Okay, does anybody else have any nominations?
Mr. Chairman, briefly.
Okay, go ahead, Senator Suderline.
I've got no problem with either of the individual nominations on their own, but I thought it was better before when we had a bipartisan leadership. And looking at the current roster, it appears I'm now the only Republican senator on here, and the delegate from Fauquier is the only Republican delegate on here. I do not want that position. I also see there's a esteemed former Republican member of the House sitting here who I think has probably the highest credentials possible. I understand the way this vote's about to go based on the appointments, but I think it would be wiser to at least have one of the positions be from the other party. Thank you, Mr. Chairman.
All right. Thanks, Senator, folks. All right, folks. Folks, we don't do that in our meetings, but just beware, okay? Okay, are there any nominations? Get up here, Kenny. You're about to be elected co-chair. Any other nominations? No other nominations. Okay, the nominations are closed. All those in favor of the motion, say aye. Aye. Is anybody opposed? Okay, nobody's opposed. If you guys can reflect, that's unanimous. Delegate Munden King, congratulations, you're not co-chair.
Thank you.
Okay, Amigo, do you want to take up number 4 now? Okay, so now we're going to have an overview of the previous joint subcommittee actions, so everybody can understand sort of where we are on this.
Thank you, Mr. Chairman. I'm going to just provide an overview of what's been happening up to this point. Senate Joint Resolution 10 was passed during the 2022 session of the General Assembly. It called for the review of several components of the states, of the Commonwealth's response to the COVID-19 pandemic. Included in the study resolution was approximately $300,000 to hire a consultant. The original deadline for the final report and recommendations was September the 1st, 2023. For a number of reasons, the first meeting of the Joint Subcommittee did not occur until April the 27th, 2023, which is a little over half into the actual study time. Because of that, it was decided by the co-chairs that a budget amendment would be put in to extend the study for an additional year, I think to September of 2024, and to extend the money that had been put in the budget to have that carried forward. As you know, there were budget negotiations that went on, and the budget didn't get passed until September the 14th. So that added a delay. But we didn't sort of waste time. What we did while we were waiting for the budget negotiations was we went ahead and did a request for information, which we put out on EVA as well as the website. We thought it would be beneficial to gain information from qualified providers as well as to just see what the potential scope was. The RFI, again, request for information, was issued on the 7th of June, 2023, with the closing date of July 23rd. As I said, it was posted on DLS's website as well as on EVA, which is the state's central procurement website, with the objective of getting maximum exposure. Tidal Basin Government Consulting LLC was the only respondent. We also, while looking at the way that time was going, we also requested from the chair of the House and Senate Rules Committee an exemption from the Public Procurement Act to give some flexibility in terms of going forward with the procurement. And in addition, because of the time period, a budget amendment was included in the current budget to extend the work of the deadline for the final report to September the 1st of 2023. Now, we did meet again on January the 9th. At that meeting, the Joint Subcommittee authorized the co-chairs to, with the assistance of DLS staff, to negotiate a contract to secure the consulting services of Tidal Basin. That contract was entered into on the 12th of January. So Tidal Basin has been working and conducting interviews. I think some of you may have been contacted up to this point. The 3-month extension that is included in the budget amendment is item 6.1C. If it passes, and I don't think that there's any controversy with it, it would extend the study or the final report deadline from September 1st to December 1st. So that's basically where we are today. I think that we have Tidal Basin that's going to give sort of an overview, status update with what they've been doing since January. Are there any questions about this long and tortuous road that we've been through this far?
Does anybody have any questions for Amigo? Sort of laid out how we got here. No, doesn't look that.
I don't want to say it was tortuous. It was long, but it wasn't
It
tortuous.
was
I had
long.
fun.
Now on our second extension, so. Okay, great. All right, doesn't look like there's any questions, Amigo. Thanks for the update. Okay, next we have I think a report from our consultant, Tidal Basin. They're going to tell us sort of where they are on their actions so far. Are they doing online? They're online, okay.
Good morning, everybody. Can you hear me okay?
Yeah. Can you get that volume up, Jillian?
All right. I just want to make sure everybody can see my screen okay.
Yeah, everybody should know you also have the presentation in your packets that are in front of you in the back.
All right, Senator Circle, can you please confirm for me if you can see that on your...
We can see it and we can hear you.
Perfect. All right. So thank you, everybody. Senator, members of the Joint Subcommittee, thank you for allowing us to be here today. It's a pleasure to brief you on the status of this very important effort. My name is Michelle Burnett. I am the project manager on this effort representing Tidal Basin. Tidal Basin, as was mentioned, we are the contractor that has been selected to perform a Commonwealth-wide after-action report for the subcommittee, focusing on the COVID-19 response. And keeping in mind that there are several new appointees, I want to be conscious of what we present this morning, particularly because I don't want to be duplicative of what folks who have already seen, but I also want to be cognizant of providing a high enough level overview for the new appointees so they have the foundation as well as to where this came from, where we are, and also sort of where we're going in this. So what we're going to talk about today, I'll give a brief intro of myself and Tidal Basin. I will give a project overview as to where we are in the process. We'll talk about subcommittee engagement, expectations, and then we'll talk a little bit about our timeline, our key accomplishments to date, and then what our next steps are. And then hopefully we'll have some time at the end for questions. Before I proceed, Senator, can you please let me know if I have a time limit on my presentation so I can gauge how long I speak for?
You don't have an official time limit. I would encourage you to be efficient, though. We've got, it looks to me like about maybe 30 people that want to speak. I don't know how many are signed up yet, but once this is all done, so.
Perfect. So I'm going to be brief then. Thank you for that. Thank you for that confirmation. So I'm going to be brief in giving some background on our organization, since I think a lot of folks have heard this already, and I want to be conscious of the folks that want an opportunity to speak. So again, high level, my name is Michelle Burnett. I am an assistant vice president here at Tidal Basin. I've been with the organization for approximately 3 years. My team handles the preparedness, resiliency, and emergency management services for many of our government and public sector clients. And really what that means is that we work with our clients on planning, on preparedness services before a disaster to get them ready, but then also post-disaster to respond, recover, and to also mitigate. So we are able to provide that full suite of emergency management services and support our clients. We're a bunch of practitioners, so we all have worked in the public sector before, which gives us a lot of breadth and depth and experience, primarily from government and all levels of public sector, from state, local, and county-wide. I worked for the state of Rhode Island for almost 20 years in their emergency management agency, focusing on the National Flood Insurance Program, planning, and mitigation. And so I will get into a little bit on the other folks in a minute, but just to give you a little background on Tidal Basin itself, we are an all-hazards comprehensive emergency management company. And so we deal with all phases of the emergency management cycle. And we want to be able to do that here, not only in the Commonwealth, but throughout the country. Moving along, this is just a very high-level overview, compilation of recent after-action reports that my team has conducted. Just in the last couple of years, we've worked across the country. We've conducted COVID after action specifically, not only here on the East Coast, but also throughout the country at the municipal, county, and state level. We've worked with the state of Michigan. We performed their COVID after action report, the state of Hawaii, and then also we're currently working with the state of New Hampshire on their COVID AAR. And all of these AARs have typically taken about 12 to 15 months to complete. Our project organization, I'm not going to get too in-depth on this. Once again, this is our team. These are the high level project team. We also have other subject matter experts that we pull into this engagement as needed. All of our experts on this team have exceptional experience, whether it be county level, state level, local level, all in emergency management. Our team leads specifically are subject matter experts in education, healthcare, emergency management, and education, and government relations and policy. So covering the spectrum of all three subcommittees that were in the joint resolution. Myself and my deputy project manager, Jessica Henry, we both come from the state as well. And so we add that additional layer of public sector experience. So let's get into the meat of this. So what we're going to go through now is a very high-level overview. This is just a very simplified version of our typical AAR process. This is what we're following right now. This is a 3-step approach, a proven system that we've used over and over again, and it really allows us to develop and work through components of the project to make sure everybody is engaged and it's digestible and manageable. We realize everyone is very busy, and so we want to make sure that we're conscious of folks' time. And we want to always provide this committee with the most complete, updated, and succinct awareness about where the project stands and where we're going. Step 1, we really just start the project off, we kick it off, and this consists really of just getting a lay of the land and a lot of the administrative tasks to ensure we're on the right track. Step 2, once we have that project team established, we begin that data collection process, and that includes data gathering, document gathering, stakeholder surveys, and stakeholder interviews. And I'm going to get into more detail on that in a moment. We then review all the documentation and begin to perform the analysis. And then step 3 is the final step, is where we move into our actual AAR development and finalization, which really culminates in the delivery of a comprehensive after action and improvement plan. So that is the process that we're following right now. So let's get into exactly where we are. So we are really in the middle of this project right now. So phase 1, we had kicked this project off back in January. We kicked it off and we concurrently worked through all of the administrative steps that we had to tackle to get ourselves situated and ensure that we had the right components in place to be successful. Prior to our kickoff, we have established the project team and the project work plan. This work plan is really our roadmap for this effort. It provides what is on deck, what's happening now, what is going to happen, when it's going to get done, who owns it, and everything in between. It's a living, breathing document that can be adjusted along the way. And so we've established a couple of things. We've established bi-weekly meetings with Amigo and the project team. Those are ongoing. We've also provided status reports in place of a meeting if needed. We've provided monthly progress reports the first week of each month, which includes what's transpired over the previous month, what is upcoming, and then any risks or roadblocks the team needs to be aware of. We've also provided monthly updates for this subcommittee specifically to status ongoing efforts, as well as upcoming efforts. Hopefully everyone has had an opportunity to review them at your convenience. And so these are our administrative steps that we've been taking and that we will continue to administer through the length of the project and through that whole period of performance. Phase 2 really is where the meat is put onto the bone, so to speak. And so this is our documentation gathering, our conduction of surveys and interviews. And this is also where we do our data analysis. And so this is where the majority of our stakeholder engagement is held. And so this phase is where we collect the information, the detail and the documentation we need to develop the after action. For example, plans are collected, processes, SOPs, procedures, executive orders, press releases, all of those things that are relevant to the response. And so we use this information to really start framing out the timeline and what transpired during COVID. And so once that data, the collection itself is complete, one of the first things that we did was reach out to our agencies. So we've got our 10 agencies and departments, our leads that are listed in the joint resolution, to request that they identify a designee to act as that conduit for us. And so we really wanted to understand who within that organization could be that primary point of contact and allow us to have those in-depth conversations, and they can point us in the right direction, because we needed to have operators in the departments that were familiar with what transpired during COVID, who was engaged and what occurred. And so we wanted to make sure that we have the most comprehensive smattering of staff, so to speak, for each department that had the most insight into the response for their respective areas of focus. And so running concurrently, during this time, the project developed and deployed a stakeholder survey that was sent to all the department designees to gauge level of engagement and individual feedback. The department designees were responsible for cascading this survey to the appropriate employees within their organization. The survey was successful. We received over 700 survey responses. We did ask a question very early in the survey to ask if the folks who were responding were engaged specifically in COVID. So only 429 of those survey respondents indicated that they were actively engaged in the COVID response. And so those are the responses that we're really going to focus on when we begin to develop the after action. We also asked the department designees to identify stakeholders that should be interviewed, and those interviews were specifically designed to align with our focus areas, which I'll get to in a few minutes. Our 4 team leads reached out to these individuals to collect preliminary information to better understand their role. And then this information really collected enabled our team to tailor our interview questions specifically to the interviewee and dig down deeper so we really get the best information from these folks. The interview scheduling began back in May on the 15th. To date, our team has conducted 32 interviews with stakeholders. We have about 6 more scheduled. And so at the end, we'll have close to approximately 40 interviews that we've conducted for this after action. And we anticipate that interviews should wrap up around mid-May. And then the third phase, we will really begin developing the after action outline for approval from this committee and the project team. In task 3.2, the outline is going to be approved. Once that's approved, we will then begin to develop the initial draft. And really based on the data analysis that we've done, we will be better able to organize our findings and incorporate this information into the draft after action and provide that first draft to the subcommittee for review and comment. We're then going to be able to incorporate the information gathered from both an after action meeting, which we will have, and then other feedback, and that will then lead into development of draft number 2 of the after action report. And really, since we're that third party, that objective third party, and we've got quite a bit of COVID after action experience, we're really able to identify areas for improvement. And so we want what's best for the Commonwealth. And so our recommendations here, in these drafts will really be based on our experience gathered from our many COVID AARs, which you had seen. And then once that after action is finalized, we will present our outcomes to this committee and appropriate stakeholders. And then once that's all done and the AAR is approved, we will then be able to close this effort out at the end of September. So really quickly, I don't want to be repetitive. This subcommittee scope everyone's familiar with. It's what was in the joint resolution. We've got our 3 subcommittees. The one thing I just want to be mindful of and reiterate is that we did separate out healthcare systems and emergency management just because we wanted to be able to dig a little bit deeper. However, all of those 4 teams will report back into their respective subcommittees. And then getting into our areas of focus, just to remind everybody, this was the original blueprint of how we had proposed to align our focus areas. These are the areas that we have encountered as the most common target areas that are best to include in after action. We have those 5 on top, those 5 circles on top, those 5 focus areas that will also fall under each subcommittee. So they cross all subcommittee topics. Those are business continuity, communications, planning and ops, financial management, and technology. And so our interview and our survey questions that were developed were comprehensive and includes all the relevant topics that you see here that fall within that focus area. In regards to subcommittee engagement, again, this slide speaks to our engagement and really what we want to see from those involved. We've had tremendous responses. We have had tremendous interaction and great collaboration with everybody we've worked with to date. And so these are the 4 elements that are really critical to our project success. The first is, roles and responsibilities, which we've defined. The next is routine updates, followed by clear communication and inclusive decision-making. And these are all iterative steps. I want to just reiterate that these are all very iterative, which are going to be ongoing and will continue throughout the project. In terms of timeline and next steps, as you can see, we break down the tasks that we've discussed into these 3 phases. We've discussed during our initial presentation back in December and January that this effort is currently a 9-month period of performance with the possibility of an extension to 12 months. So although this timeline is a bit more aggressive than our traditional timeline of 12 to 15 months, our team is absolutely on track to do what needs to get done to complete the AAR by September. However, should an extension be granted for an increased period of performance for 12 months, that will definitely give us a little bit more time to add some additional depth and allow for more gathering and analysis of information to weave into our final after action report. As you can see on the timeline itself, the green check marks are completed tasks, and then the yellow check marks indicate these tasks that are still in motion. We are currently in month 5, and this month we expect interviews to wrap up, like I mentioned, in the middle of the month, and then we can get to begin focusing on the analysis and begin drafting out the plan. Next month, during month 6 in June, we will begin development of the draft after action and begin planning for the after action meeting. In month 7, we're going to be gathering feedback and making any adjustments to the draft based on feedback received. And then we're going to finalize and deliver the final after action report and improvement plan in August and close out this project in September. So this is my last slide. Completed actions to date. We've implemented bi-weekly meetings and project updates, which we've provided. We've collected data across those highly specialized stakeholders that the designees had identified. We've developed and deployed a stakeholder survey, which we've gotten a great response. We've identified interviewees for each priority area, and we've began those virtual interviews with those key personnel. Like I mentioned, we're going to have 40 when this is all wrapped up. And then what's coming up on deck, we're going to conclude our interviews mid-May. We're going to begin drafting that outline for the after action report. We're going to conduct that thorough analysis of all of the data that we've collected from the surveys and interviews, compile that information to develop those actionable recommendations for the Commonwealth, and then we're going to commence report drafting. So those are the items that are coming up on deck for this effort. So I realize that was a lot of information and I sped through because I want to be conscious of time, but I will pause there for any questions.
Hey, Michelle, thank you for that update. We appreciate that. To me, there was a lot of process in that. And first of all, I think it's important you know that I don't think none of your updates have been forwarded to the committee. I just was back and forth with Amigo, and he told me he's going to package all of it and then forward it to everybody on the committee so everybody can see the package of stuff that's been provided. But I think some of us are just curious if you have anything of substance in terms of some of the initial findings or surprises or some initial things you've noticed or seen that you think might be of interest to us besides the process updates. Is there anything like some highlights in each of the areas that you've been coming across that you think some teasers or whatever that might be interesting to us?
Yeah, so we haven't quite begun the analysis portion yet. We're very early in the stages of the interviews, and so we haven't quite had themes pop out. the teams that are producing the interviews and conducting those interviews have had those conversations, and they're beginning to formulate their individual sort of observations from those interviews. And so high level, unfortunately, I'm not able to give themes at this point.
Okay, does anybody else have any questions for Ms. Burnett about where we are and where we're going? Ms. Siciliano, go.
Thanks, Michelle. One of the questions I have is early on in this process, I asked if we had or were planning to engage with the Virginia Hospital Association to use some of the information that they had done in their after action planning. Is that someone you all have talked to or plan to talk to?
Yep, so I believe our team, our healthcare, we've taken those after actions, and we are going to be able to incorporate a lot of that findings and that feedback into our after action report. So we are focusing on that, all the different aspects of healthcare, including that.
Okay, Senator Suderline, you have a question?
Yes, Senator Servo, or Mr. Chairman, I don't so much have a question as just a concern to express. I was under the impression that we'd get a lot more substantive information, sort of as your question just implied. And so I have significant concern about the amount of resources that have been put in this project. And I would like us to see more of the substance of where we are presently and where it's going. And it's a great concern for me.
Okay. Thanks, Senator Suderline. I agree I share your concern. I think that's why we're going to distribute everything to everybody as soon as Amigo puts it together, I think this evening or later this week. Does anybody else have any questions? Yeah, Mr. Jones. Oh, I'm sorry, Favola has one. Senator Favola, then Mr. Jones.
Okay, thank you. Thank you for the presentation. It's a good outline, but I guess my question sort of follows some of the comments that have been made. I would like some indication of the stakeholder groups that will actually be interviewed. I mean, there are a number of groups, not just constituents, but public health officials, associations, and actually there were government committees at both the local, the state, and the federal. They were all interacting on this pandemic. So I just want to make sure that we get a wide enough perspective from all the players, and I didn't get a flavor of who exactly you were going to bring into the conversation. And maybe you can provide that later, or that's a next step, but I think it's an important step.
No, I couldn't agree more. I think it's incredibly important. And so, when we had reached out not only to the department leads for folks, to be interviewed and connected with, we also asked for additional associations, folks that they think they believe would be important to reach out to. And so we can certainly provide that list to you of all of the folks and the affiliations that we have reached out to, that we've connected with. We can provide a list of interviewees themselves, those names exactly, if you're interested in that. But if there are specifics that you're looking for, we can absolutely provide this subcommittee that list so that you can see sort of the scope and who we've reached out to, and then perhaps if there are any gaps. And if you see any gaps, then we can absolutely fill. So happy to do that.
Mr. Chairman, I think that information would be helpful if it's the committee's wish.
Great. Senator Favola, I agree with you, and I think it's good for us to see a list of every organization and governmental agency that was reached out to. I think it would be very useful for everybody on here. And so, Ms. Burnett, did you say is that part of the weekly updates we've been given, or is that something else you're going to prepare and send over to Amigo?
So we can provide that larger holistic list of everybody. We have incorporated a lot of that information into the monthly updates that we've been providing Amigo. So we talked through that also during our biweekly calls with the team. And so a lot of this information has been conveyed both verbally and then in our updates. But for the more holistic list, we can provide that list separately and provide that to the subcommittee.
Yeah, I think we need to see that a list, overall list. So Mr. Jones, you had a question.
Mr. Chairman, to your question earlier, I see on your project timeline that you've got 3.2 that the 6th month you would give us a developed AAR and IP. Would you have that information to the chairman's question of a higher level, just initial takeaways from what you found so far?
So I'm not sure I'm following the questions. Or
Well,
can you
I guess just bluntly, we're trying to see where you are, what you've done, and what we might be seeing to help assist us as we are, I guess, processing the information that you're sending monthly. I think his question was, can you give us a takeaway initially, right? And you said not at this point, but you say on your project timeline that in June you'll have a developed AAR and an IP draft. I would think if you've got a draft, you would then have a better idea or general idea of where the concerns are or what you've seen to date. So that's question one. And then question two, is there value in an extension from 9 months to, let's say, 11 or 12 months of what you would bring back to the subcommittee for the Commonwealth to consider?
Absolutely, sir. So I'll start with the second question, and I know there is some discussion of an extension that's already sort of in the works, and I think Amigo can likely speak to that more eloquently than I can. And so the proposed extension, I believe, is until December. And to your question, do I think there's value? I absolutely do. I recommend the extension, particularly because it'll allow us to gain a little bit more insight and have more time to do any additional research. To Senator's point, if we have missed any group or an affiliation, we'll have a little more opportunity to reach out to them. So that'll allow us to, little breathing room in not only the data collection, but also the development of the after action. So yes, I do believe that would be very beneficial. And then going back to the first question that you had, the draft, when we provide that in June, is going to be, again, very preliminary. These are the initial observations that we're going to be assessing. And so the way we're going to be doing that is, as we get the observations, we then look through that, we do the analysis, and we then tease out the themes that we're starting to find. And so because we haven't started the analysis yet, and we're just in data collection itself, everything is just getting put into that repository, and then we can start doing the in-depth look at, okay, this is what's come up, this is what's been flagged, now we're starting to see a theme, and so that step is really what's next. So that can start right after we're finished with our initial data collection from all the interviews, because those are ongoing right now.
Thank you.
All right, thanks, Mr. Jones. Mayor Lucas Burke, did you have a question?
Yes, sir. Thank you.
Or not mayor, you're not mayor yet.
Vice Mayor, thank you.
Vice Mayor.
Yes, sir. Glad to be here. And Ms. Burnett, thank you for the presentation. I feel like I'm adequately updated. And I guess I see now why I'm here as part of the rural area, even though Portsmouth is not declared rural. Just want to make sure that some of the citizens may be included in the interviews and the surveys, because a lot of the areas that are represented sometimes in rural areas don't even have access to internet or broadband or access to be able to be included. So just want to make sure that if that's my role, that I'm here to help identify those areas that may be missed that are identified in rural communities.
Understood. So yes, we absolutely, can have that conversation to see if there are folks that, we can reach out to separately. We haven't necessarily reached out to the public at this point. We've really focused our efforts on the departments and the agencies that were listed, in the joint resolution. And then we're taking into account any additional recommendations of groups or committees or affiliations that the leads had recommended. So to date, we have not engaged with the public, but we can absolutely, speak with you. Perhaps we can even interview you to get those perspectives, of really what you want to bring to the table to make that particular item, raise that flag, right, and raise it up and to include in this effort.
Thank you.
Of course.
Okay, Senator Hashmi.
Thank you, Mr. Chair, and thank you, Ms. Burnett, for your presentation. The report is appropriately focused on what Virginia's response has been and our preparedness, but I was just curious if there's going to be any opportunity in the report to also provide a high-level overview of what other states have done or will be doing, just for comparison purposes. Does the report provide any opportunity to take a look at what other states are doing in a similar manner?
Absolutely. So we won't specifically name other states in the after action, but the information that we've gleaned and learned from the other states that we've worked with, we've taken a lot of lessons learned home. And so we are going to definitely incorporate a lot of those same findings and recommendations in our improvement plan that we've learned, that we've identified, aligning to the focus areas in those particular, areas that we think are the most in need of improvement. We're going to take those and absolutely incorporate those from the other states and localities, not just states, but even county governments, local governments that we've collected and done after actions in. We can weave all of that into our best practices and recommendations moving forward for the Commonwealth.
Great.
Thank you.
Of course.
Okay. Any other questions? Anybody on my right? You have a hot left bench? No, on my right? No. Okay. No other questions. Okay. Ms. Burnett, thank you for the update. We will look forward to all your stuff from Mr. Amigo and the supplementation. I'm sorry, Mr. Amigo Wade, right? And she's going to send you some more stuff that we asked for to be distributed to everybody. Okay?
Of course.
And
thank you so much.
Yep.
Thank you.
Thanks for all your work. Okay, so next on the agenda, we have subcommittee assignments. So for those of you who are new, we created some subcommittees that have now been all scrambled up because of all the new assignments. But we agreed on the subcommittee structure last year. You can see subcommittee 1 is government regulatory systems, and you can see underneath where it says subject matter coverage, that's what that covers. 2 is healthcare and emergency management, and 3 is education. And then, again, it lists under subject matter coverage what the areas they cover are. So it's my understanding that there's a suggestion from my House colleagues that I think Delegate Weber, who's online, wants to stay where he is. If he doesn't, he didn't tell me otherwise. But to add Delegate Sullivan to Subcommittee 1, Delegates Gardner and Sickles to 2, which is Healthcare and Emergency Management, and Delegates Shin and Munden King to Education number 3. Is that where the House colleagues are? Delegate Munden King?
Yes, Mr. Chair. We have such a depth of expertise on the House side coming to this committee that I think those would be the appropriate appointments.
Okay. All right. So you all can see on the sheets here, it shows the vacancies and it shows, I guess, some suggestions on them. It looks like Vice Mayor Lucas Burke, you've been suggested for Subcommittee 1, and Ms. Grice has been suggested for Subcommittee 1 as well. And then, let's see, Dr. Jones, looks like you've been suggested for number 2 under Healthcare, which is probably a good idea. And then looks like Ms. Dickerson Anderson for Higher Education under Subcommittee number 3. Does anybody have any feedback or comment on those? Oh, I'm sorry, and Senator Hashmi wanted to be on education, which is number 3. So does anybody else have any suggestions or feedback on that? Mr. Wade, you have a quick...
Mr. Chairman, I just wanted to let the joint subcommittee know where the suggestions came from. If you see for the citizen members, you see in the parentheses what the position was. So what the suggestion comes from is the appointee that is taking that position is suggested to refill that position, if that makes sense. So, for instance, in Subcommittee 1, the vacancy was for a local elected official representing a rural locality. The suggestion is Vice Mayor Lucas Burke to fill that position. So we're trying make it a bit easier.
Right. Okay. And Amigo, I guess we need a motion on this, right?
I think so, Mr. Chairman.
Okay. Does anybody have any other suggestions or changes or feedback on those subcommittee memberships? Oh, okay. Is there a motion that we adopt them as I suggested?
So moved.
Is there a second?
Second.
It's been moved and seconded that we rearrange our subcommittees or appoint those new people to them as I indicated. All those in favor say aye. Aye. Is anybody opposed? Nobody's opposed. Okay. So I think we're going to start getting to the meat of this over the next probably 3 or 4 months, it sounds like. And Amigo, I have on here timeline for developing recommendations, final report. Is that back to you or?
Well, just from an overall standpoint, I think that it would be helpful for the joint subcommittee to just discuss how you all want to receive the recommendations and how you want to move forward. As I said, we should get the extension till December the 1st, which would add 3 months to it. That's where you can get more citizen input. There was some discussion before when you all initially established the joint subcommittees was to maybe try to do some sort of hearings or public town halls or things like that. We're in a compressed time period. As soon as we know how you all want to proceed, we can do everything we can to make it happen, whether it be virtual or in person. But we're still looking at now a September deadline, but hopefully a December 1st deadline. So I just thought it would be a good idea for the joint subcommittee to start thinking and discussing about how they want to process the recommendations that come from the consultant.
All right, thanks, Amigo. So just so everybody knows, our current deadline is what, September 30?
September the 1st.
September 1. There's language in the current budget that pushes our deadline for reporting out to December the 1st, and I don't have any indication that's going to be a problem, assuming we get a budget. So I think we're probably working on a December 1 deadline here, and it strikes me that we're about to all get a big download of stuff from the various subcommittees that we serve on, and we're probably going to have some subcommittee meetings to take a look at that and then decide how to proceed. I mean, it seemed to me that it made sense that we at least have some kind of a public hearing on each of the subcommittees to take public input in each of the areas. It doesn't necessarily have to be in person. I mean, what did we adopt on the virtual meeting policy? Do you remember?
Well, the virtual meeting policy basically states that you cannot take votes or make motions, but you can hear presentations. And
right.
If the objective of the public hearing would be just to hear from the public, then it would be within your policy.
Right. Yeah. So we do have some flexibility there because we're not taking votes with regard to taking public input on things. So that was what sort of I foresaw, and then at some point the subcommittees need to sort of look at everything, chew on it, make their recommendations, and we need to get back together and talk as a group. And I think some of us might have opinions about what happens in other subcommittees as well. So we have to leave time for that. So
yeah. Yes, Mr. Chairman. I think that some of the thinking of the joint subcommittee back when the subcommittees were established was to sort of leverage the knowledge base of the members to get sort of a first read, and then have the greater group look at them. So that might be a good way to move forward.
Okay. All right. Well, does anybody else have any thoughts about that before we jump off and start processing all this stuff? No? Does it sound good to everybody? All right. Okay, well, get ready to start reading a lot. So, Amigo, I think we're good there? Okay. So next, even though it's not on the agenda, I think it should have been, is we have to take public comment. So we got a sign-up list. Let's see. How many we got here? We got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. So we have 22 people for public comment. What we're going to do is we're going to put a 2-minute limit on everybody who speaks. They'll give us 45 minutes of public comment if everybody stays within their 2 minutes. And so if you could come up, I'll call you up, introduce who you are, who you're with, where you're from. You can identify where you live. And Jillian will put a 2-minute timer on you, which you'll see on the screen. And we can get going, I guess. So first I have up is Reverend Craig Johnson, then I have Ann Kraft Tatus and Peter Machen. And I'll try to, if you could be in the queue or whatever, so we're not taking a lot of time to walk up every time when somebody's done. So come on up. Welcome, Mr. Johnson.
Good morning. Thank you. And I'm with the First Amendment, Inc., founder and president, and one of the 6 freedoms of the First Amendment is freedom of association. And so the concern of this planning is that in the last pandemic, there was not freedom of association. There was no medical freedom in this one size fits all. It's a 2,500-year-old fight, Plato against Hippocrates. Plato wanted the government to have top-down control of all healthcare, and every person who worked in healthcare had to be affiliated with the government. Hippocrates wanted the doctor and the patient to have a relationship separate from the government. And so we have doctors, we have pharmacists, we have hospital executives, even the lawmakers should know this. And so what we saw was with this one size fits all, which ended in the death of my father-in-law, who was given remdesivir in a hospital in California. California was one of the 5 states that mandated that COVID sick people be put into nursing homes under the guise of we're not going to discriminate against them so they can come back in this very vulnerable population. The governors of New York, Pennsylvania, California, Michigan, Wisconsin, they all mandated this, okay? Here in Virginia, that was not mandated, but there was a mandate against giving hydroxychloroquine and ivermectin, which would have saved his life, okay? 2 minutes already?
It's up there on the screen, so.
Oh, okay.
Please wrap it up. It shows how much you're over up there, too.
All right. Well, I would implore you all to analyze what happened the last time, analyze the difference between places where there was no medical freedom in these one-size government mandate fit all versus places where there was medical freedom and people were able to give the ivermectin and the hydroxychloroquine, which cost $20 for a course of treatment versus $3,500 for a course of treatment of remdesivir that killed my
Yeah, we got to keep.
father-in-law.
Look at Doug. Okay, I got it. We just got to keep moving. We got 40. We got 20 more people behind you here. So, Ms. Tatus, are you here? Yeah. Okay. And I got Machen on deck, and then Pamela Burnham behind her.
My name's Ann Craft Tatus, and I'm a mother in Chesterfield County. We may live in a post-truth society. We do not live in a post-Constitution society. So I express my gratitude for the opportunity to address our civil servants on this most important issue. To quote President Reagan, from time to time, we've been tempted to believe that society has become too complex to be managed by self-rule. The government by an elite group, your stakeholders, is superior to government for, by, and of the people. It is we the people, it is not them the stakeholders. We are a nation that has a government, not the other way around. Our government has no power except that granted by the people. It is time to check and reverse the growth of government, which shows signs of having grown beyond the consent of the governed. That's also in the Declaration of Independence. We do not consent, and we will never consent. I'm not here today to beg or plead for my liberties to be respected. I'm here to publicly affirm my constitutionally protected freedoms and my unalienable rights. We, the people, are rights holders, while governments and institutions, you, are responsible for guaranteeing those rights. You are a duty bearer. In order for human inalienable rights to be fully realized, rights holders must be made aware of their rights and given the opportunity to participate. You must respect, protect, and fulfill as a duty bearer in the Constitution of the United States of America, which is where we are. This is not up to debate. We, the people, are no longer going to let you go. We have never consulted with the people. Are you kidding me? You did all of this, and she just admitted that nobody ever consented with we, the people. And there are vehicles, I have posted up here. Your violation, deprivation of rights, conspiracy, and the color of law, you don't have qualified immunity under these. I am happy to give these to everybody, and we can come after you as individuals under the color of law, deprivation of rights.
Thank you, Ms.
civil
Davis.
rights.
If you want to hand something out, feel free to, hand it to staff and we'll circulate it. Next up, I have Mr. Machin, Ms. Burnham, and then Donna Machin.
Peter Machin. I'm with VAMFA, and I live in Matthews, Virginia. In 2020, the World Health Organization, the WHO, recommended that the COVID-19 vaccines be given to people around the world. I would like to share with you some statistics. Here are the VAERS data for COVID-19 vaccine. There have been 30,000 deaths, 16,000 hospitalizations, 11,000 anaphylaxis, 18,000 Bell's palsy, 5,000 miscarriages, 22,000 heart attacks, 28,000 myocarditis, 70,000 have been permanently disabled, 40,000 have life-threatening, 47,000 severe allergic reaction, 16,000 shingles. It's a total of 2.5 million adverse events. These shots are deadly, and many in the WHO knew it. Many people took the shot because they thought they could trust the WHO, and look how much damage it has done. Please do not let the WHO control our healthcare or our country. Remember, the WHO may try to use you for a while, but at some point, when they get their agenda through, they will have no use for you anymore. How much longer does the torch of freedom have to burn before you act to save my generation? Or will you wait until the torch of freedom is completely extinguished and you yourself have no freedom either? One of our founding fathers, John Adams, said, "Freedom once lost is lost forever." So either you can defend our rights or you can blow out the torch forever. Thank you.
Thank you, Mr. Machin, for staying your time limit. Next up, I have Pamela Burnham, Donna Machin, and Ruth Machin.
Good morning.
Morning.
My name is Pamela Burnham. I am a nurse who has been fighting in our community on the front lines since the beginning of the COVID crisis, trying to save as many lives as I can. Testimonies continue to come in about remdesivir and deadly hospital protocols still in place today. At the onset of COVID, people submitted to masks, school closures, dangerous shots, 6 feet of separation, and the contaminated PCR test because they didn't know any better, and they trusted their government to protect them. Today, the entire country seems to be becoming aware of the danger of simply trusting our governing bodies. We now know what tyranny looks like, and much of the population is using their critical thinking skills to make better decisions, thankfully. For those of you unaware of the Great Awakening that is occurring, there is a stark division between two worlds, our world and their world. Our world is composed of those who have been censored as they fought against tyranny, many of whom are scientists and are the biggest threat to the globalists because they know their deepest, darkest secrets. In this world, there are thousands of doctors, nurses, pastors, patriots who have fought for and continue to fight for this country, and freedom fighters across the country and throughout the world. Many millions have shifted over as they awaken too. Then there is the world many of you and the general public see, the world controlled by the public media and the globalist elites full of sunshine, rainbows, blackmail, and promises. The world they envision has only 500 million people in population out of 7.8 billion. The elite and their families represent only a few thousand, and the remaining controlled inhabitants will be their money-generating slaves. You may have missed the extraordinary book by Dr. Peter Breggin outlining the entire plan. It is called We Are the Prey. You may have also missed the Georgia Guidestones, which were destroyed when Roe v. Wade was overturned. It had on it the engraving of their evil plan. You think you will be one of them in their new world after the 7.3 billion are gone? You are wrong. You and your children are expendable. There is always a dark path to destruction for those who fall for the ways of evil. The only way you will retain your freedom is by fighting with us against the globalists of the World Health Organization.
Ms. Burnham, you wrap up?
Thank you.
Okay, thank you. Thank you for being efficient. Then we have Donna Machin, Ruth Machin, and Carol Sargent.
My name is Donna Machin of Foster, Virginia. It is both a right and a privilege to stand before you today. I am here as a citizen of Virginia in a free America. I exercise my rights as the self-governed externally because I am internally governed by the Almighty God, the everlasting Father, the Prince of Peace. Because I am commissioned to spread the gospel to all the world, the message that Christ died, was buried, and rose again on the third day to forgive all men for their sin if they repent and believe. And because I am the temple of the Lord, indwelt by his Spirit, I will not surrender my sovereignty and liberty, both individual and civil, to an unlawful UN body called the WHO. I cannot serve the Lord, who has promised me safety, if I surrender my external possessions and my internal conscience to an unconstitutional body. No, I resist this foe of the Republic, who would subject me to the tyranny of stolen property, my body, through mandated masks, restrictions, and shots. This Virginian will protect her life, liberty, and pursuit of happiness. Like most Virginians in 2020, I was slumbering, undiscerning, and fearful. I suffered the shame and humiliation of covering my face, made in the image of God, created to bring him glory. That hindered my ability to say that I serve God alone and that my state serves me. I suffered the loss of comfort and encouragement provided by God through my church when it was shut down. That hindered me from following God's mandate to love and good works, not forsaking the assembly. Today, I exercise my freedom of speech, religion, assembly, bodily autonomy, and informed consent. I have chosen God as my master and under the U.S. Constitution, and not to be a slave to a one-world government and bow to the WHO. He created you, the body of the Virginia Joint Committee on Pandemic Response, to protect my rights. Thank you for doing so. Do not support the WHO Pandemic Treaty and IHR amendments. Thank you.
Next up, I have Ruth Machen, and then Carol Sargent and Doris Nick.
My name is Ruth Machen from Matthews, Virginia. I oppose the WHO Pandemic Treaty and the IHR amendments. There are many aspects of how destructive this is. I personally was affected by the lockdowns because of mask mandates. I had to wear surgical or cloth masks to be able to go anywhere. After wearing a surgical mask, I would break out in a rash, or if I did the cloth, I would have uncontrollable coughing. And I was also affected by the lack of socialization. If it wasn't for God and my family, I probably would have been swinging from the bedroom curtains. We all need to be connected with people. The real concern, though, is not only the effect it has, but the lack of freedom. We are losing freedom in this country. We need your help to fight for freedom. It is too precious to lose. With your help, we can save freedom and humanity. If you don't help, we will pay a higher cost. You have a choice from this second on. Fight for us and the next generation. God will win for you. You will never be able to say no one told you. Years from now, you will look back. When we pay the price, when millions have died and been injured from these policies, all of it will haunt you for the rest of your life. If you choose to do right, your life will change forever. You'll be able to tell your children and great-grandchildren about how you fought with every breath so that they can enjoy the freedom you once had. Don't let the torch of freedom go out and send me and my generation into darkness to come. Thank you.
Thank you, and thank you for staying your time limit. Senator Suderline, do you want to say something real quick?
Yes, just briefly. I appreciate everyone that took time off in the middle of a workday to come here and express their important concerns. But just something to be very clear on, this group, we don't get a vote on any treaties. And neither does our larger bodies that we're members of. So I just want everyone to be clear on that. Appreciate the comments and standing up for individual rights people are making, but just know that no one on this panel has a vote on any ratification. And those thoughts would probably best be directed to Senators Warner and Kane. Thank you, Mr. Chairman.
Thank you. All right, so next up I have Carol Sargent, and I got Doris Nick, and then Christy Williams. Ms. Sargent, you're 16 to go.
I would say you could speak up like we're speaking up. My name is Carol Sargent, and I passed state boards for nursing in 1967. I've been a registered nurse all this time. I have a master's in public health, and I'm here to oppose the World Health Organization Pandemic Treaty. Almost 200 countries are involved, including the United States. I say no to the treaty. The recent COVID debacle was planned and carried out by a global cabal, and they call them global elitists. They are global parasites sent on destroying human beings, inflicting illness and disability. Members of my family have had cancer and also neurological problems. They took all the shots, and they will likely die a premature death. Friends have experienced heart attacks, heart conditions, Bell's palsy, everything that was listed. This virus was created in a laboratory by the NIH with our taxpayer dollars under the auspices of Anthony Fauci. The COVID injections were rolled out under warp speed without clinical trials, and I worked in clinical research at VCU and mandated for our government, by our government, as experimental vaccines that were given without informed consent. They were not proven to be either safe or effective. Our constitutional rights were infringed upon, and our God-given rights, so we have to put something in our body, our own personal autonomy. Germany has now been forced to admit by Freedom of Information Act that the pandemic was a lie. I agree. A hoax in Germany means a total global hoax was carried out in this world. People died needlessly without proper treatment, without ivermectin, hydroxychloroquine. They had to get the remdesivir because they got more money from that. The WHO treaty will be even worse. Unelected officials will be deciding what is a pandemic, and they can create one now if they want to. They're doing it, and then mandate injections, masks, and lockdowns. I see a dystopian world of people lining up like cattle, wearing their masks, each and every one, to take a shot that will kill or disable them, and then returning home to isolate and stay in their homes under penalty of arrest. It will be global tyranny, and when this happens, the suffering will be immense, not only for us, but for you also and your families. Thank you.
Thank you, Ms. Sargent. Next up, I have Ms. Nick, Ms. Williams, and then Susan Hines. Doris Nick.
You can encourage and pass this message on.
Sorry,
Please
Ms. Nick.
take strong.
Remember, I asked everybody to say where they're from.
I'm sorry, Doris Kinnick, and I'm from Chesterfield County. Please
Thank you.
take strong and immediate action to nullify the medical tyranny currently emanating out of the WHO. Even though you are stating to us that you can't do anything about the WHO, your PowerPoint that just went up, stakeholders was repeated on more times than I can count. The fact of the matter is that you have authority and a duty under the U.S. Constitution to act. The U.S. Constitution not only encourages but requires the unconstitutional laws be nullified, including those at the international level. Article 6 says the Constitution and the laws of the United States, which shall be made in pursuance thereof, shall be the supreme law of the land. If a law goes against the U.S. Constitution, it could and should be legally ignored. You have an authority and a great responsibility to protect we the people's God-given rights as outlined in our U.S. Constitution. It's interesting because Arizona this year in their pandemic response team brought in Aaron Seary and Dr. Peter McCullough. I will definitely be emailing that to you. Let me remind you clearly that you work for we the people. The Virginia, in our Virginia Constitution, Article 1, Section 2 of the Virginia Bill of Rights declares people the source of power, that all power vested in and consequently derived from the people, that magistrates are their trustees and servants, and at all times amenable to them. Trust the science has never been anything other than a marketing term that means shut up and obey. None of what we witnessed in 2020 till today was based off of science. Certainly not masking, not providing early treatment, lack of vitamin C and D, which could have greatly impacted saving lives, nor this rush to market biological weapon that in some circumstances had to be frozen below zero, nor does 6 foot safe and 5 foot danger. Neither did eating in a restaurant mask-free, but walking in you're in danger narrative. The mental, emotional, and physical abuse of masking children and telling them that they would kill grandpa and grandma has caused harm and unnecessary trauma. I want to say one last thing to you, and that is that ivermectin, Ms. Hashmi, ivermectin has and always will be safer than Tylenol. For crying out loud, it's on the WHO's list of essential medications.
All right, Ms. Kinnick.
And it's on page 7, and I've printed that for you. And here's some good books you might want to consider looking at.
Okay.
Weapons of Our Warfare, The Great Reset.
All right, Ms. Kinnick, you're 20
Would
seconds
you like
over.
to borrow these? I'll put my name on them. Anybody want to borrow these? The pandemic, the real Anthony Fauci, tons of
Okay,
data
Ms.
and
Kinnick,
information.
you're 30
in there.
seconds over. Come on, we got to keep moving.
Thank you for your time.
Thank
Your
you.
2 minutes.
Okay, next up we have Christy Williams, Susan Hines, and then Susan France.
Good morning. My name is Christy Williams, and I am from Midland, Virginia, in Fauquier County, a rural area. Thank you very much for allowing us to speak this morning. I wasn't going to mention this, but I will say that I realize that you all don't get to vote on any treaties, but I will mention that we're all in this together, and we are all humans and made in the image and likeness of God. And I just have a few questions. One is, my daughter, who has lived with asthma most of her life, Even after the governor at the time, in his mandate for masks, said that if you, for a medical reason, could not wear a mask, you didn't have to, and no one was allowed to ask you why you couldn't wear that mask because that was an invasion of privacy. But yet, how many times my daughter and myself were harassed going into medical institutions, going into stores, because she could not wear that mask, she could not breathe while wearing it. So I have a few other questions. How was it decided that we could go to the grocery store and not to church? How was it decided that landscaping was essential, but worship was not? How was it decided that masks did not work, then they did work? And how is it decided that a paper mask could prevent the spread of a tiny virus, yet we require full ventilator masks which seal around the skin to protect us from pesticides and poisonous gases? How is it decided that doctors and hospitals could not treat symptoms or try new drugs with a new virus? Who decided that the dying could not receive the last sacraments from a priest? If the priest was willing to take the risk, why was he not allowed? Why are we not allowed spiritual care? How is it that we became inhuman?
Williams. Next up, I got Susan Hines and Susan France.
Good morning. My name is Susan Hines. I'm from Williamsburg, Virginia.
Thank you.
And I'm here with the Virginia Alliance for Medical Freedom. I appreciate your time. I'm speaking for my husband. Of 43 and a half years, who died on January 22nd, 2022 at Centera, Williamsburg. Thank you for letting me appeal to you about medical freedom. My husband was refused monoclonal antibodies, which probably would have saved his life. When he was admitted to Centera, he was never given the antibodies. He was put on remdesivir, a drug known then even that it destroyed kidneys. My husband had one kidney only. He was placed in ICU on a ventilator. He only got worse. I begged multiple times for him to be put on the FLCCC COVID regimen, which had been very highly successful. His health continued to decline, and he was put on dialysis. I had multiple discussions with the assistant director of the hospital, with doctors in ICU. It was obvious my husband was dying. When asked what would be the harm of that protocol, my answer was, hospitals have rules. I was told to get a court order, which Gary didn't have time for. I spent thousands of dollars hiring lawyers and trying to get a court order. It was too late. Research shows that remdesivir has a fatality rate of over 50% because of kidney failure, but ivermectin is not toxic to the kidney, liver, heart, or lungs. Why was I the only one at Centera concerned about this? I'm a professional cellist, not a doctor. Please think about this when you're making decisions about our health. This system took away our retirement years. Thank you.
Thank you, Ms. Hines. Sorry for the loss of your husband during that time. Next up, I have Susan Franz, Barbara Zeeler, I think, and then Sheila Frevry or Every. So, Ms. Franz.
Thank you. Good morning. I'm Susan Franz. I'm from James City County. I'm a nurse, and I'm a volunteer with Virginia Medical Freedom Alliance. I have great news for you today. You do not need to have the tidal basin consultants. You do not need to find out all these stakeholders and special organizations. You have a room full of stakeholders right here, and we are happy to give you information for free. Virginia Medical Freedom Alliance has been doing nothing but studying and bombing, excuse me, I shouldn't say that word, persisting with the Virginia Department of Health and giving them information constantly now for 4 years about everything that we're discussing here today. You didn't need to hire a consultant. You have us. And I would love it if Ms.
Lucas Burke's rural people could be here, we would have gone and picked him up and brought him here. I would have been happy for that. People need to have their voices heard. Okay, the theme that the consultant is trying to tease out, I'm going to tell you what it is, and you've heard it already. It's freedom versus slavery. Freedom to live and breathe, okay? Freedom when you go to the hospital to have informed consent versus hospital protocols forced on you, like Susan Hines has just spoken about. Freedom to not wear a mask and be able to breathe. Masks have been proven to be not only dangerous, but ineffective. What's the point in that? These consultants are just going to come back and tell you, oh, instead of using a cloth mask, now you need to use an N95 the next time some germ comes down the pike. No PCR tests whose results can be manipulated and used for federal incentives. And that's another thing, federal incentives and money. It's driving this train. Speak to the people.
Thank you, Ms. Franz. Next up, again, Barbara Zedler, and then Sheila Every, and then Sharon Landrum.
Good morning. I'm Dr. Barbara Zedler, a physician from Powhatan, and I speak on behalf of the Virginia Medical Freedom Alliance. VAMPA. VAMPA and others repeatedly and unsuccessfully begged state government officials and agencies during and after the COVID outbreak for an analysis of the most important outcomes of the public health management using hard, publicly available data about deaths, serious injury, and economic impact of the range of prevention and treatment measures available, including the unapproved emergency use vaccine, lockdowns, and prolonged school closures. This subcommittee's after action report is 3 to 4 years too late and misdirected in its focus. We, the people, say nullify this unconstitutional subcommittee and all the unconstitutional and illegitimate legislation, regulations, and executive orders established and enforced during the COVID era public health emergency totalitarianism. They violated and preempt numerous limitations on the enumerated powers in the U.S. and Commonwealth Constitution, and particularly the unalienable, because they are God-given, natural rights of we, the people. None of this is about health. It is about control. That is a one-world control by unelected, unaccountable bureaucrats of the World Health Organization, World Economic Forum, and United Nations, which spearheaded the COVID-related totalitarianism that you are now assessing for how well it worked and giving them recommendations to harden it. We are a hair's breadth away from a vote at the World Health Assembly on passage of terrifying amendments to the WHO International Health Regulations and their Pandemic Preparedness and Response Treaty.
All right, Dr. Zedler, you need to wrap it up. You're over your time limit.
And that will completely and illegitimately, if passed, usurp the U.S. Constitution, the VA Constitution, and enforce its control by a one-world military. You are on notice.
Right.
Educate yourselves and
Thank you,
resist
Dr.
it.
Zedler.
Thank you.
Okay. Next up, I have Sheila Fury. Okay, then Sharon Landrum and Michael Gardner.
Thank you. I'm Dr. Sheila Fury. I'm the president of the Virginia Medical Freedom Alliance. I am fundamentally disturbed by stakeholders. Has this committee considered interviewing the hundreds of doctors around this state who actually treated COVID, and had their patients live, versus the hospitals, which were death traps and morgues? What happened when people went into the hospital is they got remdesivir, put on a ventilator, and they died. What happened when they saw good doctors all around this state who provided early treatment with ivermectin, hydroxychloroquine, and numerous vitamins and supplements? Those patients lived and never saw a hospital. But you're not going to hear about those because you're so closed-minded, because you've got your stakeholder interest. What do we have here? We have essentially a government bureaucracy that doesn't care about the people. You say you care, but you have had one opportunity after another to look at the evidence. You have Dr. Paul Merrick in this state who was world-renowned for his work. And did you once interview him? Did you once invite him to the Capitol? Did you once invite him to the Virginia Department of Health? Did the Secretary of Health interview Dr. Merrick? Did you interview Dr. Peter McCullough? Did you interview Dr. Robert Malone? The answer to all of those questions is no, because you were so closed-minded and you wanted people to die because it pushed your protocol, that COVID was something to be frightened of. And then you said, okay, let's give everybody a shot because that's going to solve the problem. The problem is we have an epidemic of people dying from the vaccine that you said was so safe and effective. And our cardiologists, neurologists, and oncologist offices are filled with young people who are dying because of that shot. Thank you.
Thank you, Dr. Fury. All right. 9 to go. Next up I have Sharon Landrum, Michael Gardner, and then Brenda Levy.
I'm Sharon Landrum with King William County. I'm here today because I do not want a repeat of the devastation and destruction caused by Virginia's COVID-19 policy. This policy weaponized fear of a modestly pathogenic respiratory virus to trample upon our constitutional rights and our God-given rights to breathe. I personally suffered because I refused to wear a mask. I had a medical exemption. I was prohibited from air travel, medical buildings, funerals, restaurants, stores, you name it. I was harassed by fellow Virginians for not complying, marginalized and discriminated against. However, the deadly COVID protocols had even graver consequences. 2 previously healthy friends of mine died because of the CDC protocols of no early treatment and then hospital protocols of remdesivir. The mandated bioweapon gene therapy has disabled and killed countless friends and relatives of mine. Instead of following the guidance of over 940,000 professional signatories of the Great Barrington Declaration, Virginia chose to accept the false narrative of the corrupt and captured CDC, FDA, and WHO. These COVID pandemic policies were not based on science, but on fear, manipulation, greed, and control over the population. Now the chickens are coming home to roost. Those who fell for the lies by taking the experimental bioweapon shots are experiencing sudden death, miscarriages, stillbirth, sterility, neurological damages, cardiac damages, strokes, turbo cancer, and autoimmune disorders. I urge this committee to consider new pandemic policies, not the ones based on science, but propaganda like the mask, the social distancing, the jabs, which prevented neither infection or transmission. Follow the lead of Dr. Latipo in Florida. Listen to physicians like my sister in Tennessee, an internal medicine physician who provided successful early treatment to over 8,000 COVID patients, but was accused of mis and disinformation. In summary, you're being held accountable today for your pandemic policies. We will not comply this time with nonsense and tyranny. Thank you.
Thank you, Ms. Landrum. Next, we have Michael Gardner, Brenda Levy, and then Holly Rode.
I have my presentation for somebody to copy and distribute.
Okay, you hand that out to staff. Thank you. All right, Mr. Gardner.
My name is Michael Gardner. I live in Richmond, Virginia. The WHO, the World Health Organization, wants to have control in handling future pandemics or whatever they think needs to be controlled. The WHO is associated with the UN, and they have wanted Agenda 21 and Agenda 2030 to control us. America is one of the largest contributors to the WHO. The organization had no authority or ability to get China to provide information about the origin of COVID-19 or the health or death risks, which left America in the dark. We could not even trust America to give us the truth about the pandemic, based on the mandates, medical passports, masking, shutting down non-essential businesses and churches. Social media controlled all acceptable information. The CDC, FDA, NIH withholding the truth about vaccine injuries, and not allowing the use of ivermectin or hydroxychloroquine, doctors losing their licenses or credentials because they didn't go along with the new accepted protocols. The lies about how deadly COVID-19 was led to these poor decisions and more loss of life than should have occurred. Another lie could lead to the WHO to shut down and control America. We would be controlled like China. That is unacceptable. We would be giving up our life, liberty, and pursuit of happiness. I pray we do not let the WHO control America. God bless America.
Thank you, Mr. Gardner. 7 to go. Miss Brenda Levy, then Holly Rode, and Kathleen Levitt.
Good morning. Thank you for your time. My name is Brenda Levy. I'm from Chesterfield. I am retired. I am 73 years old. I did not get any of the shots, and I went to the gym the whole time that COVID was going on. I finally did get COVID last year in June, and it wasn't much. It was probably one of the BXX variants. I found out that it was COVID by giving myself 2 home tests. I would like to continue to have the freedom to make my own healthcare decisions and think that everyone else should be able to do so as well. Thank you.
Thank you for being efficient, Ms. Levy. Next, I have Holly Rode, Kathleen Levitt, and Kathy Tankersley.
Good morning. My name is Holly Rode. I live in Woodland Heights, and I'm with all these fine people right here.
Is that in Chesterfield? Got it. Okay.
City of Richmond.
Oh,
City of
Richmond. Got it. Thank you.
Pandemic preparedness. I have to ask myself and everyone here if we are really interested in preventing another pandemic. Wouldn't we be looking first and foremost at the origin story of COVID? Lab leak, gain of function, or planned all along? And regardless of whichever one you subscribe to, because clearly we're still not really talking about the actual origin story of the pandemic, and furthermore, when will we be? To realize that any of these is absolutely diabolical and the furthest thing from actual democracy. Cost-benefit analysis, the vaccine Bible, at least with COVID. The belief system was we couldn't get it, we couldn't give it, it wouldn't replicate. But that was not the truth. Couldn't be further from the truth, in fact. As a result of this being more of a technology versus vaccine that can and does replicate in many more worse ways, it's referred to pathological priming. And I'm a firsthand, I understand this firsthand because I actually have an autoimmunity, and my rheumatologist and many others were saying that the results after the shot were much worse than expected. Pathological priming. And I've got news for you folks. I take hydroxychloroquine, and it works. And the entire state of Uttar Pradesh in India used ivermectin with glowing results. And this is still not public knowledge. And then there's the social repercussions. In addition to the health repercussions, case of my neighbor lost her church and her OBGYN all in 1 week as a result of not choosing to take this experimental gene-altering technology. Despondent does not even come close to describing the way she felt.
Need you to wrap up, Ms. Rode.
So cost-benefit analysis, the story still unfolds. In a sane world, we would acknowledge without any hesitation that lingering effects of this damaging and completely untested protocol. This is the current template. This is clearly a departure from democracy in more ways than I can count, so I urge you to heed the message and choose Virginia health sovereignty for medical health freedom.
All right. Thank you.
Do the right thing.
Thank you, Ms. Rode.
Thank you.
Okay, next I got Kathleen Levitt, Kathy Tankersley, then Janice Weingart.
Kathleen Levitt, Chesterfield County. Thank you for listening. I'll read quickly. The term conspiracy came about after JFK was murdered, And it has become a useful term to denigrate people who disagree with a narrative. So conspiracy theories have become a convenient term ever since to discredit those who disagree with the narrative being espoused. Those of you who have studied history researching Mao and the Cultural Revolution, as well as Karl Marx's theories, would recognize, understand those who disagreed with the one-party system's policies were discredited or worse. With the pandemic, we've witnessed the same Marxist policies when gifted medical doctors advocated for the use of hydroxy and ivermectin for early treatment. They were shamed and threatened as there was a vax in the pipeline. My own truthful doctor told me in March of 2020 that it would be prudent if I got this illness to take ivermectin, hydroxy, azithromycin, vitamin C, vitamin D3. He was honest, and to get in the sunshine. So the health authorities at first said no masks, no social distancing, and women shouldn't take the shot. Then all of a sudden they turn around and flip-flopped. Now they need the masks, now they need the shots. It all changed. On December 8th, 2020, Senator Johnson had a meeting with 3 docs. One doctor endorsed the shot, a second one wanted hydroxy, ivermectin. The third doctor worked on the mRNA, and he suggested not taking it. I have so much to say. I have lost people, friends, relatives to the shot or who were injured by it. My husband was in a rehab center to learn to walk better. We were not allowed to see him because he was unvaccinated. We stood outside the windows yelling, trying to get contact with him. And it was just miserable. And it wasn't right. He was a veteran. He deserved better. And so did all the people in hospitals and in nursing homes.
Okay.
You deserved better.
Need you to wrap it up, please.
I will wrap it up.
You're 30 seconds over, so that's the most we will let anybody. We need you to wrap it up.
Come on. The one bright spot in this is that some of the people who've been injured, damaged, or who had deaths in the family are now pursuing legal action. And there are lawsuits coming all across this country.
Right. Thank you, Ms. Levitt.
People who have been damaged. Thank you.
Okay, thank you. 4 to go. We have Kathy Tankersley, Janice Weingart, Ann Robeson, and last will be Karen Reardon.
My name is Kathy Tankersley. I'm a concerned citizen. I think the pandemic was very poorly handled, and I hope that you will learn from that and do something very, very different, because it was very destructive and very damaging in this state and across the world. I'm here to represent a disabled lady because she couldn't be here. She was very traumatized and suffered much from the policies of the pandemic. I probably won't get through her whole testimony, but, yes, it's anecdotal, but she represents a lot of people around the world. Mrs. Rock, a mother of 3 and a small business owner in Virginia Beach, Virginia, suffered with severe PTSD, which is substantiated in years of medical records. Wearing a mask caused her panic attacks. During the mask mandate, Mrs. Rock experienced extreme discrimination on the basis of her disability. Her request for ADA accommodations were denied time and time again when she visited multiple doctor's offices and hospitals for tests. I mean, think about this, a disabled woman who needs to go to a doctor and experiencing all this discrimination. Mrs. Rock was denied medical care 4 times for different procedures across Hampton Roads. She was humiliated by office managers who chose to violate state and federal disability laws in fear of violating unproven mask mandates. She was forced to sit in a construction area on a dusty floor near construction workers who could hear her private medical information just to get a telehealth appointment. To wrap it up, to honor your time. Mandates do not and cannot supersede the rights of those in protected classes. Thank you.
Thank you, Ms. Tankersley. Next up, I have Janice Weingart, then Ann Robeson, Karen Reardon.
Thank you. I'm Janice Weingart from Henrico. My husband and I had a terrible experience concerning medical freedom. We had to hire a lawyer, $20,000, to try and get a hospital to give an extended family member vitamin C. There was no way that they would even consider ivermectin or hydroxychloroquine. He was in a hospital with COVID and was on the death protocol of that hospital. Unfortunately, he died before the judge signed the papers for vitamin C. We, the people, absolutely need to be able to make our own medical decisions. Virginians must be given a voice in this significant decision. Thank you.
Thank you for being quick, Ms. Weingart. Last two, I have Ann Robeson and Karen Reardon.
Hi, good day to you. My name is Ann Robinson. I'm in Yorktown, Virginia, and I became very sick with COVID in 2021. And as soon as it was reported to the Virginia Department of Health on that weekend, I started getting harassed by our government on my tax dollars, saying they needed to speak with me immediately over my recent health condition. And so had HR House Resolution 6666 had been, if that had been passed, I would likely not be here today. I would be dead. I feel like we've not experienced the last attempt to shut us down and take control of our country by the WHO, or as known as communism. So I say to you today that I am for no draconian Marxist dictatorship or any pandemic policy or to any of the World Health Organization dealings. Thank you so much. Have a good day.
Thank you, Ms. Robeson, for being quick. Last up, we have Karen Reardon.
Hi, I'm Karen Reardon. I'm from Hanover County. During the pandemic, I was out in Chesterfield. I actually moved my family because the school system saw fit to keep education closed to our students. I come here without any prepared comments because I wanted to hear what you had to say. I wanted to see how you would react to the people in this room who've lost family members, including myself. So I hear this pandemic preparedness, and I wanted to see what you were going to talk about doing differently. Because I think what we learned was how much was wrong. And what I'm concerned about is the stakeholders and the data that's being collected seems to be that it's going to be collected in an echo chamber. And we see that by virtue of the fact that this committee only has 2 opposing party members here. I see a woman from UVA who is in communications and PR from an organization that tried to refuse a man a kidney transplant because of vaccination status, and who imposed mandates on a student body in an age group and demographic that we already had data was showing us that those people would be harmed more by the vaccine than they ever would have been by the virus. I remain concerned. I would love to see this body show a little bit of leadership to the rest of the country and say, you know what? We took a legitimate look at everything that was right and all of the wrong that occurred. And the reason you hear people talk about the WHO is because the concern is that this body will adopt the measures by the WHO. The WHO and the CDC, who showed us that they really didn't have the best interests of health of people in their minds when they came to it. So I'm asking you to please listen to both sides of this. When you collect that data, you talk to the citizens, you talk to all of the many organizations like VAMPA and React 19 who had patients who were harmed by the vaccines and by the measures within the hospitals, which, by the way, there is a clear pattern among hospitals across the Commonwealth, which I will continue to urge Jason Mieres to investigate for criminality. So thank you,
Ms. Reardon.
and I certainly hope you all please show some leadership in this and be
Okay, thank
in
you,
a
Ms.
place.
Reardon. You're 30.
I understand, but people also gave back time.
40 over.
I
Thank you.
hope that you all will please just consider both sides of this story and make a legitimate pandemic preparedness plan.
Thank you, Ms. Reardon. What, you didn't sign up? I didn't have the opportunity. Okay, 2 minutes. Name and where you're from in 2 minutes. You'll be the last one.
Good morning. My name is Becky Keeley, and as I know, this committee has numerous decisions to make in regards
Sorry,
to...
Ms. Healy, where are you from?
I'm from Caroline County.
Thank you.
In regards to pandemic policy, I'm here to speak to the harm done by federal, state, and county leaders to my family during COVID. I'm not going to speak to the senior citizens, the grandparents that we had to say goodbye to through the glass at their nursing homes. I'm not going to talk about how my kids were actively engaged playing on the swings when they came to shut the playground down, and they said they would start with the basketball hoops first before they came to rope off the swing sets. I'm going to back up first and talk about something else. I'm coming to you as a prior Marine Corps wife and a current law enforcement spouse, 20 years, nearly 20 years, and our marriage was first under the weight of the military combat deployments and has since been under the very real and costly weight of the badge. We serve because it is my husband's God-gifted calling and my calling to stand beside him. And for 18 years, I have been open palmed to the Lord and to our country with the most valuable and precious, irreplaceable humans, one of them in my life, so that Americans, Virginians, can live peacefully and freely. My husband has to know what he believes and why in order to do a job that puts you in harm's way overseas. And he has to know his why in order to do a job here at home that may very well cost him his life, especially a thankless job that many despise you for doing. And as a spouse, living like this keeps me in touch with my convictions and beliefs. It is beyond true that the whole family serves. And in 2019, for an incident that occurred on Christmas Day, while I and my kids were waiting for him to come home so we could open gifts, my husband was called to a scene where he would later be awarded with a Medal of Valor from both the Virginia Sheriff's Association and the Virginia Chiefs of Police. He was a hero, if you will. Unfortunately, the state's egregious and tyrannical COVID overreach took him to 0 just a short time after, as he was fired for refusing to comply with the mask mandate. For a state whose motto is thus always to tyrants, and for Hanover County, who proudly claims to be the birthplace of Mr. Give Me Liberty or Give Me Death, the response of state and local officials was abysmal.
Right.
The mask and test and vax mandates were unconstitutional. They violated our rights to free speech, freely worship, freely assemble, right to bodily autonomy, and informed consent. Our God-given inalienable rights and freedoms are guaranteed in the Constitution. They are not canceled just because you serve in the military,
Need you to wrap it
or
up.
when you walk into a hospital or school, or during times of national emergency. Case after case, leaders
Need you
at
to wrap
every
it up,
level
ma'am.
put institution before constitution. It is unacceptable and inexcusable, and I will end with Proverbs 3:27. Do not withhold good from those to whom it is due when it is in your power to act.
Okay, thank you for the comment. All right, thank you for all the comment. Let's make sure everybody notes that the point of this commission was to go back and look at exactly what happened during the pandemic and make sure we had an opportunity to learn some lessons from it. And that's exactly what we're doing. We're gathering information right now from various stakeholders. We're going to have public hearings about it. We're going to take continued public comment about it. This is started as a bipartisan joint task force, and I would note that the administration also has 5 representatives on here as well, in addition to a couple Republican members. You know, Mr. Jones, who was actually a Senate pick, was a member of the other party, but we picked him because of his deep knowledge in state government, and I think we have a good group up here, and I think we're going to reach some good conclusions. But we're obviously just getting started on the data analysis piece of it. So you all just have some patience. We're going to start seeing some substance here in the next 5 months. But that's it for the public comment. There's nothing else on the agenda today.
Mr. Chair.
I'm sorry, my co-chair. Anything you'd like to say?
Yes. I want to start by saying thank you to those who have joined us today to share their opinions. I've heard a lot about freedom today. But not everyone has the economic freedom to come to a committee meeting in the middle of the day to share their opinions. So I think it's important to note for those who have lost, who have been impacted by the pandemic, and for whom many people on this committee, this was before I was elected, made very difficult decisions for those families. And I want to thank my colleagues for those very hard decisions during those dark days when we really didn't understand a lot of what was happening. So for those who believe in vaccines and those who understand that the medical system was doing everything that they could to save lives, their voices will be heard in this process as well. And so it's very important that as we go across this process, that folks understand that we are completely open because we are human beings as well who are not immune to loss. COVID did not ask if I was a Democrat or a Republican when it impacted my family. It didn't matter that I was a law enforcement wife. So for those who don't have the privilege of coming to these types of meetings, I want to make it clear that I am committed to hearing all of those voices. And as I've watched this committee in the past, I've heard the same willingness to be open to that as well. So thank you, Mr. Chair.
Thank you, Delegate Munda King. All right, is there a motion? We don't have anything else on the
Move to
agenda?
adjourn.
There's nothing else on the agenda. Is there a motion to adjourn?
Second. Moved and second.
Okay, then seconded. All those in favor of adjourning, say aye.
Aye.
Anybody opposed? No, we're adjourned.
Senate of Virginia, Richmond, Virginia.